to ensure that I'm speaking with the right patient. So today, Mr. Tony, I will be conducting a neuromuscular assessment on you, and any significant findings will be cascaded to your doctors for the next treatment plan. Do you have any question, Mr. Tony, before we start? Thank you. So there is a request from your doctor to a urinalysis, and I have here a specimen cup. Please void and fill this up to this line, and once you're done, you can place it on the examination table. So, Mr. Tony, I have here a hospital gown with me, and do you need any help in changing cloth? Okay, thank you. Please change cloth on this side. As I'm conversing with Mr. Tony, I observe his overall hygiene and physical appearance, and the patient is dressed neatly and his hair is combed, his skin is clean, and nails are well trimmed. He is also dressed appropriately for the occasion and weather, and he appears to be relaxed and no involuntary movements were noted. So, alright, Mr. Tony, I will be asking you a few questions to assess your neurovascular system. So, to start, do you know who I am? Are you also aware where you are right now? Okay. Can you tell me what time is it?
4.
Alright, Mr. Tony, I have here a 3 object with me. I have here a alcohol, a rock, and a ball pen. And I'm going to put this away real quick, and could you please recall what is the color blue? Okay. And what object did I show you first? Okay. So, Mr. Tony, can you describe the home you were growing up in? Thank you. And can you tell me what school did you went in your junior high school? Okay, thank you. Mr. Tony, what is your understanding of the saying, action speaks louder than words? Okay, so now I have here a pen and a paper, and can you please draw a tree for me? How about number 7? Can you also please read this silently and do what he's asking for? Okay, here that was not your hand. And can you read what's on this paper? With the pen and paper you're holding, can you write something about the weather today, Bob? Okay, so the weather is hot. I have here 2 bottles with different scent, and I'm going to ask my patient to cover her eyes and upload 1 nostril and let him identify the scent. So, Mr. Tony, can you close both of your eyes? Okay. And can you upload 1 of your nostrils for me? Okay. I will be introducing a scent, and can you tell me what it is? Okay, now let's proceed with other nostril. Next is I'm going to check the visual acuity of the patient using a Snellen chart. So I have here a Snellen chart with me, a improvised Snellen chart because we don't have any Snellen chart at home. So for the Retdem video purposes, I'm going to use this. I'm going to stand 20 feet away from the client, and since the client is using a eyeglass, I let him wear it, and I'm going to instruct the patient that he will be reading the lowest line that he can read, and I'm going to ask him to cover his right eye and ask the patient what line can he read, and I'm going to have the patient read that line and have the patient switch the cover of the eye and do the same thing and reading the lowest line as he can, and I'm going to ask the patient to uncover both eyes and read the lowest line again. Thank you. Next is for the accommodation. I'm going to stand 2 to 3 feet away from the patient, and I'm going to hold the pen light in front of him and ask the patient to focus and follow the pen light as I move it closer to her face up to his nose. So, Mr. Tony, can you please focus on this pen light I'm holding and follow it as I move it closer to your nose, okay? Next is for the light response. So for this procedure, I'm going to darken the room and ask the patient to look straight ahead. Then I am going to shine light first towards the facial midline. Then I'm going to approach each eye from the side. Sir Tony, please look straight ahead and just stare at the wall in front of you. And I will have to darken the room for this procedure, okay? Now for the 6 cardinal fields, I'm going to stand in front of the patient and ask the patient to follow this pen light as I move it on the 6 cardinal fields. Mr. Tony, can you please follow this pen light I am holding and follow with your eyes only? Next, I'm going to assess the cranial number 7 or the facial. I am simply going to ask my patient to smile, frown, wrinkle forehead, and puff out cheeks. Alright, Mr. Tony, can you smile for me? Now frown. Can you wrinkle your forehead? Now puff out your cheeks. Now for the whisper test, I'm going to assess his cranial number 8, which is the acoustic. I am going to stand about 1 to 2 feet away from the patient up to her line of vision, and I'm going to ask the patient to cover the ear not being tested. And next is I'm going to whisper words to the uncovered ear, and I'm going to have the patient to repeat those words. Alright, Mr. Tony, I am going to whisper some words on the other ears, and once you hear them, can you please repeat those words? And first, we're going to cover your right ear, okay?
1, 2, 3, 4.
Okay, your left ear. 4, 5, 6.
4, 5, 6 now.
Next, we're going to do the cranial number 9, the glossopharyngeal, and test for the gag reflex by touching the posterior pharynx with a tongue depressor. Alright, Mr. Tony, this might be uncomfortable, but I will need to check your gag reflex. Can you open your mouth for me and open as wide as you can and say Now I'm going to assess the cranial number 11, which is the spinal accessory. I will place my hands on the patient's shoulder while he strikes against the resistance. Then I'll place my hand on the patient's left cheek, then the right cheek, and have the patient to push it again. Okay, Mr. Tony, I am going to apply resistance on your shoulder. And can you try to resist it and shrug your shoulders for me? Okay, thank you. Okay, on your left cheek. Okay, thank you. On your right cheek. Okay. Alright, Mr. Tony, can you touch your chin to your chest? Okay, thank you. Then to each shoulder. Then your ears to each corresponding. Okay, and now tilt your head back as far as you can. Okay. Could you please extend your arms for me? Okay. And can you turn your palm up and then down? Okay. And now can you repeat it and do it faster as you can? Alright, Mr. Tony, can you flex your upper arm like this po? Okay, and try to resist the pressure I apply. Okay. Can you squeeze my finger? Squeeze harder. Now we're going to check for the sternocleidosis. I'm going to ask the patient to close his eyes and I'll place a familiar object on his right hand, and first I'm going to ask him to identify the object, then we'll repeat on the other hand with a different object. Alright, Mr. Tony, please close both of your eyes po. Put your here. Then I'm going to place an object on your left hand, and can you please tell me what is it po, the object? Okay.
Clear out.
Okay, thank you. Now we're going to do the same po on your right hand.
Repeat.
And now, we're going to check for the graphesthesia. I'm going to ask the patient to close his eyes. Using my finger, I'll trace a one-digit number on the patient's palm and ask him to identify the number, and then I'm going to repeat it on the other hand with a different number. Alright, Mr. Tony, can I have your right hand? Okay po. Can you please look away to the left? And now I'm going to stroke on your palm, and I want you to guess the number.
Repeat.
Okay, thank you. Okay, let's do it on the other side of your left hand. Can you please look away to your right? Okay. Now we'll perform the assessment on hip and knee range of motion, starting with straight leg test, and I will have to place my patient on a supine position and have the patient to strengthen both legs with arms at the side, and then I'm going to ask the patient to raise the right leg first at a approximately 45-degree angle or as high as he can, then we'll repeat on the other leg. Alright, Mr. Tony, can you please lie down? With your arms on your side. And can you raise your right leg po as high as you can? Okay, you can put it down. And can you do the same thing with your left leg? Okay, thank you. Next is we're going to perform a abduction-adduction test. For this, I'll ask the patient to move one leg laterally with the knee straight to test the abduction, and medially to test the adduction of the hips. Sir Tony, can you move your right leg away towards the right side without bending your knee? And put it back po all together. Okay. Now, do it on the other leg po. Now put it together. Okay, thank you. Now, I'm going to ask the patient to raise the thigh against the resistance of my hands. And next is to have him push outward, still against the resistance of my hands. Then push inward without the resistance, and we're going to repeat it on the opposite side. Right, Mr. Tony, can you try to raise and bend your knees as you try to resist the pressure being applied po? The right leg first. Okay. Then we'll do it on the left leg po. Okay. Alright, Mr. Tony, can you bend your right knee and have your foot resting on the bed? And now try to bend your knee up and have your feet resting on the bed, and try to move it in upward direction. So to your right po, and resist the pressure I'm going to apply. I want you to resist the pressure po. Okay po, I'll do it on the left leg po. Bend the knee. Okay. And I want you to resist the pressure po. Now we'll assess for the plantar reflex. To do this, I will stroke the sole of the patient's foot with the end of a hard object and observe for the patient's plantar reaction, then we'll repeat on the other foot. So, Mr. Tony, I'm going to stroke your feet this time, okay? After we check the patient's ankle muscle strength and range of motion, I'm going to ask my patient to dorsiflex and plantar reflex both feet at the same time, and then resist the pressure I'm being applied. So, Mr. Tony, can you flex both feet at the same time in downward direction? Okay, how about in upward direction? Okay, thank you. Okay, this time I want you to flex it inward direction again, but now try to resist the pressure I'm being applied. Okay? Next, we'll proceed with the tandem walking. First, we'll have the patient walk normally, then walk in a heel-to-toe to heel manner. Mr. Tony, I'm going to have to ask you to stand for me po. Then please walk from this point, from there po, and walk like how you normally do. Now, can you please walk where your right heel will touch your left toes po? Lastly, we're going to perform the Robert's test. I'm going to ask the patient to stand straight with feet together, both eyes closed with arms at side. I will then wait for 20 seconds to observe for patient swaying and ability to maintain balance. Keep in mind that we must be alert to prevent fall or injury related to losing balance during this assessment. Mr. Tony, can you please stand straight with your feet together po? Then I want you to close your eyes and try to be still for 20 seconds. Okay? I already assessed the patient to a comfortable position, and I'm going to perform hand hygiene. So, Mr. Tony, I have gathered all the information needed, and rest assured that this information will be kept confidential and will be cascaded to your doctor for the next treatment plan. So, do you have any question po? Okay. So, thank you, Mr. Tony, for your cooperation.